Okay, hi Mrs. Jennings.
Hello.
My name is Gunnar. I'm going to be your student physical therapist today. How are you feeling today?
Feeling alright. Had better days.
Had better? Well, that's to be expected after that surgery you had.
Yeah.
Are you having any pain right now?
Just got a little bit of pain right in here.
Okay, and how would you rate that pain on a scale of 0 to 10?
Just sitting here, it's like a 2.
Okay.
But when they made me, well, I don't know if they made me, they helped me. Get from the bed to here, it went up a little bit.
Okay.
Like, I'd say like a 4.
Okay. So it's not super bad when you're sitting down.
Nah.
And can you describe that pain for me?
It's kind of more like I can touch it where the pain hurts. It's kind of like on top.
Like right on that incision line there?
Yeah, it goes right up and down, right where they cut me open.
Okay. And it's not similar to the pain like you came in here with, like that shortness of breath or chest pain like you came in with?
No.
Okay, good.
Totally different.
Okay, and I just wanted to remind you that we never want to feel that feeling again in the hospital when we're doing any exercise or anything. So if you're feeling that same shortness of breath feeling, or we call it angina, that chest pain like you had when you were coming in, definitely let somebody know. If I'm not here, let somebody else know, and we need to get that taken care of.
Okay.
Okay. So I'm just going to ask you a couple of questions. Can you tell me your full name?
Mrs. Jennings.
That's a good name. Do you know where we are right now?
Yeah, we're at this school.
Okay. Yeah.
Hospital.
The school hospital.
The school hospital.
Do you know what time of day it is?
Sometime in the afternoon.
Okay. That's right. And do you know why you're here in the hospital?
Yeah, I was having those chest pains, and then they had to do surgery. They had cut me open here and take something out my leg.
Yep, that's exactly right. Sorry we have to ask those questions every time just to make sure we're kind of with it. Sometimes medication can make you drowsy or something, and so we just want to make sure you're not getting too drowsy.
Okay.
All right, so are you okay if I look at your feet really quick and just kind of assess the capillary refill down there? They probably did that last time.
Yeah, for sure.
Okay. That looks good. Looks good. And have you been having any pain in the back of your leg along here at all?
No, only where they took the
Just right in that incision there?
yeah, where they took that piece out.
So I'm just gonna, any tenderness back here?
No.
And that on this side?
No.
Okay. And so we do that to check for deep vein thrombosis. They probably told you that last time. So that's just a blood clot in your leg. So if you're ever feeling like a weird pain in the back of your calf that has just kind of come on, please let one of us know so we can get that looked at too.
Okay.
Okay. So before we get started, I'm going to take your vital signs. And so our goal today is to get you up and walking a little bit more than you did last time.
Okay.
And we want to get you kind of independent with our walking. So when I take these vital signs, I'm going to show you how to take your own heart rate too. And so that when you're up walking, maybe with your husband or somebody else, you can monitor yourself and make sure we're staying safe.
Sounds good.
Probably about sick of this blood pressure cuff by now, but it's very important that we know this information.
That's alright, it's your job. I'm kind of a nice patient.
I got 118/76, so that's really good. We're actually just going to leave that on there.
Okay.
I'll just set this in your lap for a second if that's okay. Okay, and so as far as heart rate goes, have you ever taken your own heart rate before?
I remember a long time ago, like they told you had to like put your finger somewhere on your wrist, but I don't know much from that.
Yeah, so you have an artery coming down your wrist, and so the easiest way to find it is to put 2 fingers on this bone right here. Just follow that bone down until you feel that big bump.
Okay.
And come right down off of that. Yep, and you should feel kind of a little pulsating in there.
Okay, yeah.
Okay, and so the easiest way to take your heart rate is to take it for 15 seconds. So I'm going to do it with you. You can look on my watch and tell me when you're going to start. And we'll count the number of times it goes for 15 seconds. And then we'll multiply that to get it per minute.
Okay. We'll go on the 12.
Okay.
Okay.
Okay, so what'd you get?
I got 23.
Okay, I got 22. So that's pretty close. Sometimes you can be a beat or 2 off. So that would mean your heart rate right now is 90. Yeah, 92.
Okay.
Alright, so that's our resting heart rate. So 92. And with that medication you're on, the beta blockers, we don't want your heart rate to go 20 beats above that 92. So that's what you're looking for when we're out exercising. When you take your heart rate, you want to make sure your heart rate will be below 112. So
Okay.
if it ever gets above that, we need to take a break, we need to rest, we need to let that heart rate go back down before we continue exercise. Maybe not get it up that high next time.
Okay. Sounds
Okay.
good.
So I'm gonna put this gait belt on you.
Okay.
And while I'm putting this on you, go ahead and do a few of those ankle pumps that they taught you last time, just to kind of get the blood flowing before we stand up. How's that feel?
Well, that's fine.
Not too tight?
No, not too bad.
Okay. Get back here. Okay, good. Alright, so let's get you standing up. And once we stand up, I'm just going to take your blood pressure again right when we stand up, just to see how your body adapts to being upright. So, if you remember from last time, I can hold this. Nose over toes, we're going to lean forward. And before we do this, I just wanted to remind you of the sternal precautions they taught you last time.
Okay.
So that's, we don't want you pushing off the chair like this, and we don't want any arm movements above 90 degrees. So don't want our arms up here, over here. We don't want to do any kind of this motion.
Okay.
Because that's just going to put a lot of stress on that incision there, and we don't want that right now.
Okay.
Okay, so I'm going to help you up. So just lean nose over toes. You do as much as you can, and I'll help you. 1, 2, 3. Perfect. That was great. All right, how you feeling right now?
A little dizzy.
A little bit. Okay, do some weight shifts. Kind of wiggle those toes. Sometimes that'll kind of get the blood pressure up and make you feel less dizzy. Okay, how you feeling now?
A little better.
Okay, so I'm going to take your blood pressure real quick.
Okay.
So it went up just a little bit, but that's to be expected with some exercise. So we're looking good there. Got 122 over 80. All right. And actually, can I have you sit back down really quick? We better get your non-slip socks on before we take you out in the hallway. It's pretty slick out there.
All right.
So, sorry for the extra exercise, but it's good to practice standing up and sitting down.
That's all right.
Okay, you ready to go?
Think so.
All right, we're gonna go for a walk out in the hall, and we're gonna try to be gone about 5 minutes.
Okay, sounds good.
Okay, so lean nose over toes again, and we'll stand back up. Okay, good. Just stand here for a second. Feeling dizzy at all?
Not as bad as last time.
Okay, good. Yeah, I'm gonna hold this. There we go. I'm going to manage this in the back, and you can just start walking. Alright, how are you feeling as we get walking?
So far so good. It's pretty early. I wouldn't doubt it gets harder later.
Yeah, sometimes you can get pretty tired. But less work than you think.
I noticed last time when they got me up out of bed so I can go to the bathroom.
Mm-hmm.
I don't know, I just got real tired real quick.
Yeah. Let's take a left here.
Okay.
Yeah, and just let me know if you're feeling any of those symptoms of shortness of breath or dizziness or anything like that.
Okay.
So on that dyspnea scale last time, from 0 to 4, 0 being not out of breath at all and 4 being like so out of breath you have to stop, when would you say you are?
Oh, like 1 or 2. Pretty low, I think.
Okay, let's take a little bit of a pause here.
Okay.
Yep, and let me come on this side of you actually. We're going to take your heart rate again. So this is something that you need to be doing while we're exercising. So let me know when you're going to start. We can start at 12 again.
Yeah, let's do that.
Okay, what'd you get that time?
I got 25.
Nice. I got 24. So we should be doing good there. We're still under that 112 beats per minute.
All right. Awesome.
So let's go down just a little farther, and then we'll turn around and head back to the room.
Okay.
Okay, let's turn around here.
Okay.
How you doing on that shortness of breath scale?
It's a little painful breathing in right now.
Is it?
Yeah.
Where would you say you are on that scale?
1, 2. Definitely 2.
And where's that pain at when you breathe in?
Darn.
That incision
Where
there.
they come up.
Yeah. So that's going to be sore for quite a while. It's a pretty big incision, but it'll be healing up slowly but surely, and pretty soon you won't even notice it.
All right. Awesome. I'll take it.
So we would be out there for about 5 to 7 minutes, but for the sake of the video here, we're going to cut it a little short. based on how you're doing, I think we could probably do 7 minutes today, but we monitor you.
Okay.
Okay. Hips over here. I want you to turn to your left. And back up until you feel that chair on the back of your legs.
Okay.
Good. And then we're just going to sit right down nice and slow. Hands over toes. Alright. And I'm going to take your blood pressure again right after your exercise, see how you did.
Okay.
Alright. Got 126 over 82, so that's perfect for being out exercising. Didn't go up too much, so that's really good.
Cool.
And let's take that heart rate again real quick. Do it with you one more time. Might as well start on the phone.
It's kind of a rhythm, huh?
Alright, what'd you get?
I got 21.
Nice, me too. So that's good. Now that we're sitting down, your heart rate's gone down a little bit, so that's a normal response to exercise, and you're doing really well. So again, just watch out for when you're up walking around. Take that very often as you can, and just make sure it's not going above that 112 area.
Okay.
Okay. And then we're going to take those again in 5 minutes. Make sure you're still recovering good. But while we're here, I just wanted to ask you a few questions. How have you been doing with your incentive spirometer, that thing that you suck into and hold the balls up? They taught you that?
Yeah. So they told me to get the second ball up.
Mm-hmm.
My goal is to get to the third one down the road.
Yes.
But for right now, I'm doing pretty well with it.
Have you been doing it as often as they've said to you?
I'm sure I should be doing it more, but yeah.
And what about those ankle pumps? Have you been trying to do those about every hour?
When I remember to do them, yeah.
Okay.
Especially like if I'm watching TV,
Yeah.
if it hits like a commercial break, I'm like, oh yeah.
Yeah. Yeah, those are good to do just whenever you think about them. You can't really do them too much. They're just really good for getting that blood flowing. And another thing I wanted to discuss is cardiac rehab. They've probably talked to you a little bit about it, but it's going to be kind of an outpatient place that you'll go to when you're out of the hospital. So you'll come there once or twice a week, and they have a lot of equipment there to be able to monitor your heart rate and your vital signs really well. So kind of like we did during exercise, but a lot better. So they'll be able to kind of push you a little harder in a very safe manner. And there's a lot of staff there, so everything is very safe. And the benefit of cardiac rehab is your heart's just like any muscle. It needs time to heal, and it needs some therapy to heal. So they'll provide that therapy, get you working out, and studies have shown that people who attend cardiac rehab more have a lower chance of death 3 to 4 years out from their injury. So that's a really good reason to go. Lower chance of death is always good.
Yeah.
Yeah, so it's been almost 5 minutes. We're just going to take it one last time.
All right.
Just to make sure your body is recovering well from exercise. Based on what I saw today, you did really great.
Cool. Cool, sorry. Getting close to dinner.
Yeah. We have good food here in the hospital.
Ah, it's terrible.
Oh, man. I always take my own lunch, so I don't know. Alright, looking good. 122/78.
Nice.
Okay, well, good job today.
Thank you.
Hopefully dinner will be in soon. Is there any other questions you had for me before I leave?
Not that I can think of.
Okay, sounds good. I'll probably see you tomorrow morning. Have a good night.
Alrighty.